the three of us to introduce ourselves. I am Delsi Mariauta Salim, usually called Ocha. I am act as a midwife.
Hello, I am Emerenciana Relin. I acted as the first patient with a family planning counseling case.
Hello, I am Paula Pratisisa Namal, plays the role of the second patient with a history of pregnancy.
Midwife. Good morning. Morning. Please come in. You can sit down here.
Thank
you. Welcome. Okay, the first patient, Mrs. Relin. First, I will check your blood pressure. Your blood pressure is normal, is 110 over 80.
Okay, thank you, midwife.
Okay, you're welcome. Hello, good morning, Mrs. Relin. Please have a seat.
Good morning, midwife Ocha. Thank you.
You're welcome. So, I see from your appointment notes that you come today for contraception counseling, specifically for the birth control pill. Is that correct?
Yes, that's right. I've been thinking about starting on the pill, but I want to understand more about it before making a decision.
That's very wise. It's always a good idea to fully understand your options. Let's start by discussing your medical history, just to make sure the pill is a safe option for you. Do you have any history of blood clots, stroke, heart disease, or high blood pressure?
No, none of those. I am generally healthy.
Good. Do you smoke?
No, I don't.
Excellent. Smoking combined with the pill can increase mortality risk, especially for women over 35. May I ask your age?
I am 27.
Perfect. Do you have migraines, especially with aura?
No, I only get my headache sometimes, but nothing severe.
That's good. Do you have any liver disease, gallbladder disease, or a history breast cancer?
No, nothing like that.
Wonderful. Based on your talk, me so far, you sound like a good candidate for the combination birth control pill. Now, let me explain how the pill works. The pill contains two hormones, estrogen and progestin, which prevent ovulation. They also thicken the cervical mucus, making it harder to sperm to reach the egg, and thin the uterine lining, making inspiration less likely.
I see. That sounds effective. How effective is it?
When taken perfectly, that means at the same time every day, it's more than 99% effective. But with typical use, because people sometimes miss pills, the effectiveness is about 21%.
What happens if I miss a pill?
That's a common concern. The evidence does strongly support that the pill causes significant weight gain for most women. Some women may notice milk fluid retention, but it usually is not substantial. If you maintain a healthy diet and exercise, it shall be an issue.
That's good to hear. Are there any serious risks?
There is mal-increasing, rise is blood clots, stroke and heart attack, especially in women who smoke, have high blood pressure, or are over 25. But for healthy, non-smoking women in your R group, their rise are very low.
That's reassuring. What if I want to stop the pill in the future?
You can stop at any time. Your fertility usually returns quickly after discontinuing the pill. Often within a few weeks, some women may take a bit longer to resume regular cycles, but pregnancy is possible as soon as you stop.
That's good to know. Is there anything else I should consider?
Yes, the pill doesn't protect against sexually transmitted infection. So, if you are not in a mutually monogamous relationship, using condom is advisable. Good question. If you miss one pill, take it soon as you remember and take the next one at your usual time. Missing more than one pill can lower the effectiveness and you may need to use backup contraception like condoms for a week.
Good ear. Are there any side effects I should expect?
Yes, some women experience side effects when they first start the pill. This can include nausea, breast tenderness, spotting between periods, and mood change. Most of the side effects usually go away after a few months or your body adjusts.
What about weight gain? I've heard people say the pill makes you gain weight.
Also, some medication can interfere with the pill's effectiveness, such as certain antibiotics or seizure medication. Always inform any healthcare provider that you're on the pill.
That makes sense. I'm currently not taking any other medication.
Excellent. Do you have any personal preferences about starting the pill? For example, some women prefer to start on the first day of their period, while others start on the first Sunday after their period starts.
I think I'll start on the first day of my next period. I think I'll start on the first day of my next period.
That's perfectly fine. I will write your prescription today. I would like to see you again in about 3 months to check how you're doing. If you have any problem before then, please feel free to call or make an earlier appointment.
Thank you, Midwife Ocha. You've been very helpful and thorough.
You're welcome, Relin. I'm always here to help. Take care and don't hesitate to reach out if you have any concerns. Okay, next, Mrs. Betty. First, I will check your blood pressure.
Okay, please give it a try.
Terima kasih, sudah. So, okay, Mrs. Your blood pressure is normal, is 110 over 70.
Okay, thank you. Bye.
You're welcome. So, Mrs. Pretty, congratulations on your pregnancy.
Thank you, Midwife Ocha. I'm very excited but also a little nervous. This is my first pregnancy.
That's completely normal. We will go step by step. Today is your first prenatal visit. So we will gather a detailed medical history, do some initial tests, and talk about what they expect. First of all, how many weeks pregnant are you now?
Based on my last period, I think I'm about 8 weeks.
Wonderful. We will confirm that with an ultrasound later. Now, let's start with our medical history. Do you have any chronic medical condition like diabetes, hypertension, thyroid problems, or autoimmune disease?
No, I've been pretty healthy so far.
Any surgeries in the past?
I had my appendix removed when I was 16, but nothing since then.
Any allergies to medication, food, or substances?
I'm allergic to penicillin. I get headaches and trouble breathing if take it.
Good to know. We will avoid penicillin-based medications for you. Now, do you take any regular medications, vitamins, or supplements?
Just prenatal vitamins that my doctor recommended.
Excellent. Are you taking folic acid?
Yes, my prenatal vitamins include 800 micrograms of folic acid.
Perfect. That's help prevent neural tube defects in your baby. Do you smoke, drink alcohol, or use recreational drugs?
No, I don't smoke or use drugs. I stopped drinking alcohol as soon as I found out I was pregnant.
That's excellent, Betty. How about your family history? Any genetic disorders, birth defects, or inheritance condition in your family or your partner's family?
No, nothing that I know of on either side.
Good. Let's talk a bit about your current symptoms. Are you experiencing nausea or vomiting?
Yes, quite a bit of nausea, especially in the morning, but I haven't vomited much.
That's common during the first trimester. Make sure you stay hydrated, eat small frequent meals, and avoid foods or meals that trigger nausea. If it gets worse or you can keep food down, please call me.
I will. What about weight gain? So I worry if I haven't gained any weight yet.
In the first trimester, it's normal not to gain much weight, especially if you're dealing with nausea. Most women gain around 1 to 2 kilograms in the first 12 weeks. The important thing is to eat nutritious foods and stay hydrated. We will monitor your weight gain at each visit.
Okay, that's good to know.
Are you experiencing any cramping, bleeding, or unusual discharge?
I had a little spotting early on, but nothing heavy, and it stopped it after a day.
Spotting can happen early in pregnancy, but if you experience heavy bleeding, severe cramping, or pus tissue, call me immediately. Do you exercise regularly?
I used to go to yoga classes twice a week and do light jogging.
That's great. You can continue light exercise as long as you feel comfortable. But avoid high-impact sports, contact sports, or activities with a risk of falling. Prenatal yoga and walking are excellent.
Got it? And how often will I have appointments?
Typically, you have monthly visits until about 28 weeks, then biweekly until 36 weeks, and weekly after that until delivery. Each visit will include monitoring your weight, blood pressure, urine tests, measuring the baby growth, and listening to the heartbeat.
It sounds very organized.
Yes, we will also schedule important screenings at around 11 to 13 weeks. First trimester screening for chromosome abnormalities. At 18 to 20 weeks, anatomy scan to check the baby's development. Around 24 to 28 weeks, glucose tolerance test for gestational diabetes.
Wow, a lot to keep track of.
Don't worry, I will guide you throughout every step. Do you have any questions so far?
Actually, yes. I read about certain foods. I saw avoid. Can you clarify that?
Of course, avoid raw or undercooked meats, unpasteurized dairy, contains of cheeses, raw seafood like sushi, high mercury fish like swordfish or king mackerel, and limit caffeine to under 200 milligram per day. Also, thoroughly wash fruits and vegetables.
Oh, be careful. What about traveling? I have a world trip planned next month.
If you're feeling well, travel during the second trimester is usually safe. Stay hydrated, move around frequently during flights, wear comfortable clothing, and bring your prenatal records with you.
Excellent. Thank you for all this information. It really helps to calm my nerves.
You're very welcome, Pretty. Pregnancy is a journey, and I will be here to support your trip out. Before you leave, we will do some blood work and schedule your next appointment.
Thank you again, Ocha.
You're welcome, Pretty. I will see you in a few weeks.